This isn't another episode that scares you, it's one that gives you a plan. Dr. Anna Rosa explains what's driving stroke risk at the root level, inflammation, and the practical steps that change the game.
The new technology now allows eye doctors to detect early warning signs of vascular disease, often before symptoms appear. So we're talking about stroke, we're talking about stroke prevention. Using a simple non-invasive test called optodynamometry, or what we call ODM for short, we can measure retinal artery pressure and uncover hidden risks to the brain and the heart. Today, we will explore how this breakthrough is connecting eye health to brain health, and how collaboration between eye doctors and radiologists using carotid ultrasound and transcranial Doppler ultrasound may help prevent strokes before they happen. Joining me is return guest Dr. Anna Claudia Rosa. She's a radiologist, she's an MD, a PhD, and an expert in neurovascular imaging and stroke prevention. Together, we'll uncover how the eye may become medicine's newest window to saving lives. Dr. Rosa, thank you for joining me again today on the Dr. Kerry Gelb Open Your Eyes podcast. We're going to get, so after we get a report, now back to revascularization. Obviously, we can't do revascularization in the brain. It's one of the blood vessels in the circle of Willis, one of the 20 different types of findings that we could get. So typically, what's the treatment? Is it just blood thinners? And before we get into diet, but what's the traditional treatment? And then we're going to get into functional medicine kind of treatment or prevention. But is it typically just blood thinners that they're going to use?
So I am a radiologist, so I don't know much about the treatment, but I know they do antiplatelets, right? I know they do blood thinners, and they control better the hypertension, and atrial fibrillation control is also important. Another thing that I would think, and I do know they have some procedures in the brain that could improve vascularization as well, done by neuroradiologists, interventional radiologists. I'm not going to go in that lane because I haven't done this this is really, really specific for their specialty. Like I do thyroid biopsies and they do neurovascularization in the brain, right? So yes, you could do antiplatelets, you could do blood thinners, you take care of the blood pressure, you take care of, some people might need statins. I don't want to go into statins because I have a different opinion, but yes, some people would go into statins as well. I don't think that the cholesterol is the major problem here. I think it's the inflammation that we have to take care, because like we just discussed a few minutes ago, like the inflammation is happening in your whole body, right? Is the inflammation from the visceral fat, the fat around the heart, the vascular disease from endothelial dysfunction in your whole body, and elevated glucose, elevated insulin resistance, and all the inflammatory molecules that are activated, like interleucin 1, 6, macrophages, fibroblasts, tumor factor necrosis alpha, all these things that are related in this huge cascade of inflammation in your body. So definitely for me, is much more, I definitely would focus, especially if you are in the category of intima media thickness or starting to build plaque, still have a soft tissue plaque, especially if you are in the beginning. I would definitely do very strict lifestyle measurement changes, because you could improve, and you could even reverse, and you could you could not let it progress, right? Which is what we said: eliminate processed foods, sugar, carbs, alcohol, sleep, sun, sauna, cold, nutrition, hydration, movement, all these kind of things. Yes.
With more screen usage and indoor time, myopia, also known as nearsightedness, is increasing and getting worse in children. Now, certified eye doctors can prescribe MiSight One Day, the first and only FDA-approved soft contact lens to slow myopia progression in age-appropriate children. Visit CooperVision.com to find a Brilliant Futures certified eye doctor near you. So I want to ask you also, and I want to get a little bit in depth more on the prevention part of it, but between races, do you notice a difference in Asians? I saw a study where Asians tend to have clearer carotids, but they have more problems with one of the 20 different intracranial measurements during TCD. Or African Americans, Hispanics, white, Caucasians. Do you find differences in where they lay plaque whether it's in the carotid or in the brain, or you don't really find a pattern of differences based on race or based on gender?
In all honesty, I have not paid attention to race because I have never like did a research myself with my own patients, and I really read more about the data and how to evaluate the parameters, right? Compare the morphology, compare the velocity, compare the waveform. That's what I focus more. I do believe that in men, it might be more severe than in women. However, women in menopause are less protected. So then you start increasing your rate of having vascular disease as well. Let me see what else you asked, like race
You know,
and age, the older, yes.
just from your experience, I don't know, even if you're as a radiologist, if you're paying attention to the race, if you even look at that because you're not seeing the patient, but just for some patterns. You know, I saw in a study about Asians and that it was more in the brain than in the carotid, and I was just wondering if that was something that you happen to notice. But if it hasn't, it's not that big of a deal. I
I
want to
did not.
I want to ask you about
I
the
haven't noticed, but I haven't, again, it's because I haven't paid attention. Yes, on that.
I want to ask you about the transcranial Doppler report that we get. You know, we're going to get a report back, and say we see and we're going to go. They're going to give us each blood vessels: the right medial
Yep,
carotid artery, the left medial carotid artery, the right,
yep,
anterior carotid artery, and they're going to go through all the different arteries down to the basal. You know, may 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, like 11 or 12 different vessels they're going to tell us. Now, say everything is normal, but one blood vessel shows elevated velocity. One vessel is there's a problem. The left medial carotid, there's a problem, consistent with mild moderate stenosis. So if there's one blood vessels, but all of them are normal, does that mean that treatment should be initiated? You know, I know that typically, like you said, the radiologist won't do the treatment, but from your experience, are they going to typically do treatment at that point and use blood thinners or conventional treatment in addition to lifestyle?
if one vessel in the transcranial Doppler, only one vessel has elevated velocities, and you said the left middle cerebral artery, definitely if it was me, I would definitely want more investigation to know what's the reason, right? So that could be done. Um, and if I haven't had a Doppler carotid ultrasound, I would step back and I would want to have my carotids evaluated to make sure that there is no soft tissue plaque, to make sure that there's no more stenosis anywhere else, right? On a second note, I would definitely want to have an MRI of my brain to check, to look for small vessel ischemic disease, to check for, any other cause that would be any other anatomic problem that could be leading to increased resistance. And I would definitely, it would be a good thing too, if it's only one vessel, to have an MRA of your brain, because the MRA would tell your provider if you have, it would evaluate the plaque. Do you have a plaque in your middle cerebral artery? Is this plaque soft? Is this plaque calcified? Either it could be a CT angiogram of your head and neck, or it could be an MRI angiogram of your head and neck. The MRI angiogram does not use contrast in general, but it's not very helpful in seeing calcified plaques, right? It will show that there is stenosis, but it will not show the calcified plaque. The CT angiogram, it's done with IV contrast, and that's better on saying, okay, there is a plaque, there is a portion that is soft tissue, and there is a portion that is calcified. So then I would have the whole map of what's going on in my brain, right? Okay, I have elevated velocity that indicates increased resistance. What is the cause of the resistance? There is a plaque. Is it soft tissue? Is it calcified? Are there any other areas in my neck that might have plaques? Maybe I even need, by doing other evaluation, maybe I even have to do some kind of evaluation of my aorta as well. And definitely, I would start immediately with the lifestyle strategies, and I would rely on the provider to define, okay, you're going to need medication for blood pressure if you have hypertension. You're going to have to take care of your atrial fibrillation. You're going to have to take care of, I just forgot hypertension. Oh, and the blood thinners. So then it would be a decision from the provider depending on all the other exams that defined a little bit more the cause of the elevated velocity, right? Yes.
I know this is a simple question for you, but for our audience, what's the difference between MRI and MRA?
So the MRI is we have sequences that are evaluating the brain, the brain parenchyma. So we are checking more. We can see the vessels, especially if there is intravenous contrast. Of course, we can say something about the vessels, if there is a dissection, if there is narrowing, if there is occlusion. Of course, we can do all of that. But the MRI is mainly evaluating the brain, the cerebellum, and the ventricles, the size of the cerebral sulci and the ventricles, saying if there is hydrocephalus, if there is brain atrophic changes in decreasing of volume. We could say, oh, there is more frontal atrophic changes, or more frontal or more parietal atrophic changes, or more temporal atrophic changes, which will lead a little bit for people who are evaluating for dementia as well. We could see mass effect, which is when something like a tumor is deviating everything from one side to the other, which could be a cause of increased intracranial pressure. We could see evolution of infarct, stroke, detection of acute stroke, and we could see also evolution of bleeding, hemorrhagic stroke in your brain. So there are all these things that we could see with the MRI. The MRA is MR angiography, MR angiogram. So it's mostly to evaluate the vessels of your brain. And sometimes if you ask MRA of the neck, also the vessels of the neck. Some places only do one sequence of the brain and everything showing the brain, and everything else is just vascular evaluation. Other places do a little bit more sequences of the brain and the vascular evaluation. So that's the main difference. It's like many cases when you order just the MR angiogram, you're going to have many more images of the arteries, and you're going to be able to see narrowing, stenosis, anatomic variants, like you could have a hypoplastic vertebral artery, or you could have different communicating arteries in your circle of Willis, so normal variants, or you could have other causes of vasculitis, right? Not that will change the shape of the arteries. They could be more like string and bead or pearls, and each one has a pattern of vasculitis. And the MRI does not show the vessels like as a 3D image. It could show, like I said, dissection by changes in signal, but mainly shows what's going on in the brain as a major picture.
Let's go and get back to the carotid
Yep.
for a second. How much narrowing do you think is too much, and what do you feel is borderline that for clinically significance, where we really have to start worrying about a stroke?
I love this question. I absolutely love it, because the people I know that have carotid Doppler ultrasounds, they are always concerned. Oh my God, is it too much? Is it too much? Should I worry about that? First of all, you should always worry about taking care of your body, because you don't want your arteries to be in trouble anywhere in your body. However, let's think about the carotid again. What we are looking at a carotid Doppler ultrasound, we are looking at the velocity, and the velocity gives us the degree of stenosis, right? But we are also looking at major findings that are of high risk for stroke, which is the intima media thickening and the morphology of the plaque. So even when a person comes to a radiologist and they don't have any plaque, therefore they are not, and then don't have any abnormal velocity, therefore they will be having a normal report for stenosis. They might have intima media thickening. That is the first sign that there is endothelial dysfunction, and you should start acting right there, because it predicts that there is disease and that this disease can progress, and that's when your lifestyle measurements would be the best, right? We should pay attention in the plaque morphology, because if you have greater than 70% stenosis, however, your plaque is fully calcified, that's considered in the majority of the times a quiet, silent plaque, more stable. Yes, you have the stenosis, and yes, by the Nesset criteria, it was proved there is a higher risk for stroke, and you are going to be referred to vascular treatment and decide with your doctor and provider if you're going to have revascularization. However, many patients, and these are the patients that are at high risk, even higher risk for stroke, is the patient that has, even if they don't have higher velocities, even when they don't meet criteria for higher degree of stenosis because of the velocities, they have a soft tissue plaque that is unstable. What is an unstable soft tissue plaque? That overrides the velocity criteria in being the major prognostic of stroke. The soft tissue plaque that is irregular, that is ulcerated, and we can see that with ultrasound, because the soft tissue plaque that is irregular is considered an active plaque. There is inflammation, there are macrophages. So when everything is going on in the inflammation cascade, there is a higher risk of releasing fragments, which are the emboli or the thrombus, right? Which are the cause for the stroke. And when there is a damage in that soft tissue plaque, that it becomes ulcerated, we can see high turbulence, we can see high flow with ultrasound, with the blood flow blinking there inside of the plaque. And that's also a plaque that is at very high risk for emboli, which is predictor of stroke. So it's not only the velocity, it's always velocity, intima media thickness, waveform shape, is it proximal or distal occlusion, stenosis, and the soft tissue and the morphology of the plaque, particularly soft tissue, irregular and ulcerated.
So now let's talk about stroke prevention. And we talked
Yes.
about this and root cause. You mentioned insulin resistance, metabolic syndrome as a cause, oxidative stress, and mitochondrial dysfunction. Talk a little bit about that as one of the causes, about why mitochondria is so important.
So everything is inflammation. The mitochondria is the tiny participant of your cell that in your body that is responsible for energy, right? So you need energy for cleaning your body from toxins. You need energy for your brain to work. You need energy that will put ATP, which is energy, inside the cells. So you're going to be like processing all the reactions in your body that are important to keep you alive and healthy. So oxidative stress is damaging your mitochondria and is related to inflammation. Inflammation, as we already said, is related to cytokines, which are the molecules of inflammation, interleucin-1, 6, activation of macrophages, activation of lymphocytes, natural killers, activation of fibroblasts, fibrosis. Inflammation is related to insulin, elevated insulin and insulin resistance, elevated blood sugar, elevated triglycerides, fatty liver, and cirrhosis, and dementia, vascular or Alzheimer's. So your brain doesn't have enough energy because the mitochondria is not working well. So it doesn't use the lymphatic system. That is the way of cleaning from toxins. And again, it's during the deep sleep. So it's really important for us to focus on the things that bring inflammation to our bodies and the things that feed inflammation in our bodies, because it's not only eliminating the food, the processed foods, the sugar, the alcohol. It's also like, what could I add that would help with the inflammation nutrition strategies? Like it has been proven that exposure to sun helps mitochondrial regeneration. It has been proven that creatine also helps with mitochondria function in your brain when you take a little bit higher dose than it would be only for your muscles. It has been proven that stress strategies like sauna, cold plunge, cold shower, sprinting, high intensity exercises to decrease stress like burps, squats, burpees, squats, jump jacks, they kind of decrease your stress, decrease your cortisol, and decrease your inflammation in your body. So it's not only the nutrition, but also the other strategies that will decrease the inflammation, because the inflammation is damaging your body from head to toe. Like in your head, it's causing the vascular dementia, the small vessel ischemic disease, the abnormal deposition of protein, amyloid, and tau, Alzheimer's, in your diabetes, in your eyes, the diabetic retinopathy, or the macular degeneration, that is also inflammation, right? The hypertension, the same problem in your eyes and in your brain. And then in your heart attack, and atrial fibrillation, or cardiac arrhythmias, other cardiac arrhythmias. And in your lungs, asthma, in your pancreas, like the diabetes, again, diabetes type 2, in your liver, fatty liver, fibrosis, inflammation, cirrhosis, liver cancer. So your whole body is suffering from the inflammation, right? Yes.
You mentioned sauna. Do you like infrared or do you like the standard finish type of sauna?
I am an advocate of the standard finish because I have learned from Sean O'Mara, my friend, my mentor. Um, However, I would say uh, easy, fun, simple, joyful. Because if it's not like that, you don't do it, right? So if you have access to an infrared sauna, you could have lower times in the sauna, and you might have be having some kind of benefits as well. Like red light therapy is so good as well. Not the same thing as infrared sauna, but again, whatever you have access, it's better to do it one step at a time than, oh, I don't have the finished sauna and I'm going to be waiting until I have it. Yeah.
And if you live in a warm climate like me in Florida, do you need a finished sauna or could you just go sit outside and sweat?
That's true. Some people say that depending on the amount of time you just sit outside, or for example, in a garage, it could work almost as sauna. And cold plunges. Some people are, I'm not going to do a cold plunge, or I'm not going to do a cryotherapy, cryo something, get inside the freezer and stay there for 3 minutes. There are some recent studies showing that just 1 to 3 minutes that you finish your shower and you are there in super cold water is very beneficial as well. For ADHD, since I have just been diagnosed with that, I am learning that when I am low energy and I am not being able to focus and I am with analysis paralysis test, if I get a shower and I stay, some studies showing that if I only stay for 10 seconds in a very cold water, it changes my physiology, it changes my state, and it brings me to focus again. 10
Have you
seconds.
tried it?
I did. And it definitely, well, you wake up, right? Because you're like, oh, with the water. Yes.
That doesn't seem like
Yes.
fun. That doesn't
It
seem.
does not, it's not fun. You have to be screaming like I do. I'm like, oh, inside of the shower,
So we did
jumping.
root cause. We're talking about root cause of vascular damage. So we did insulin resistant, oxidative stress, and mitochondrial dysfunction, chronic inflammation,
Yes,
endothelial dysfunction. We need to keep the blood pressure regulated. How about heavy metals and toxins?
absolutely. Yes. I am here in this longevity. I am right now in a longevity conference here in Utah, and they are just going to discuss about that mercury and bismuth, and what's the other, lead, all these things. And what I've learned so far, not in this conference, but what I've learned so far when I was reading for myself, it's very important to have a good quality of water for you to drink and take a shower. So chlorine is very detrimental for your gut microbiome, which has been proven to be the king of your body, right? So water with chlorine or showering with chlorine is not good for your health and your inflammation. So definitely have a chlorine filter, which is not very expensive. It's one, and many houses might already have them as well. What is a little bit more expensive would be a reverse, not little bit, would be a reverse osmosis filter. So what I did is I have a chlorine filter where I get my shower and the water for the house. And then I have a reverse osmosis filter only for my kitchen sink for my drinkable water. So it's cheaper, right? I didn't want to pay like how many $1,000 for the reverse osmosis filter for my whole house
Yeah,
because I decided
I think it's like $30,000 to do one for your whole house.
exactly. So I didn't do that.
I have this under my sink. I can't remember what it was, but it was less than $1,000, maybe.
Exactly. Mine was less than $1,000 too. So it's an investment that it's definitely worth it because it's the water that you're drinking that will not bring toxins, heavy metals, right, to your body, and will also help with your gut microbiome health.
And in New Jersey, I called my water company, and they came and they installed one, and you just pay a monthly fee for it. And
Yes.
you have to change the filter every year or every 2 years. So you keep
Yes.
up on that. And the last one of the causes of vascular damage or something increase your risk of a stroke, you mentioned just now gut dysbiosis. And so with all these, do you take any supplements every day? And if you do, what kind of supplements do you take?
So uh remind me that I want to talk about movement as well. Okay. So far, I know you said this would be the last one, but I would definitely want to talk about movement just a little bit.
Sure.
So for the gut microbiome, your microbiome, the majority of us have a microbiome that is addicted to carbs. And that's why we are craving so much. And when you sugar and alcohol and processed foods, and when you are giving this to your microbiome, you are leading into inflammation, and then you have the leaky gut. And then there's inflammation again in your whole body. And in your microbiome, in your gut, you have cells that produce neurotransmitters, similar and even more than your own brain producing neurotransmitters, like dopamine, serotonin, and everything else. So it's really important that you focus on healing your gut microbiome. How do you do that? And that I learned with Sean too, and a little bit more that I'm researching myself. So how do you do that? First, you have to starve your microbiome from everything that is the inflammation root. So you have to kill your microbiome cells right now, the ones that are bad. The same way that you could starve cancer by doing the same, cancer cells by doing the same thing. Eliminate all processed food, sugar, alcohol, everything we talked before. And you give your gut microbiome the food that is optimal for that, for it. So protein, good quality of protein, good quality of eggs, good quality of yogurt without sugar, good quality of meat, good quality of fish, good quality of chicken, low carb if you decide to do low carb, but like mainly if you would, I would go strict, not doing carbs for a while until you heal yourself. And then if you want to add carbs later, add very little, but like low glycemic index. And fermented foods. All kinds of fermented foods are live foods that when you are giving them to your microbiome, you are regenerating your microbiome. What Sean says, which I think is very interesting and very smart, is the fermented food is not supposed to be something that you are going to eat to feel full. The fermented food is like you have your meat, you have your butter, you have your eggs in the center of your plate. And then you have a pinch of sauerkraut, a pinch of onions, a pinch of green beans, a pinch of carrots, a pinch of blah, blah, blah. You have 7, 8, 10 different fermented foods that you can get either online or either on Whole Foods or Trader Joe's or whatever grocery store you have, or you can even adventure and become fermenting your own foods. So again, the fermented food is like a garnish, a little bit of mustard that you're going to eat, different ones, so then you have variety. Avoid milk and get kefir, fermented cheeses, fermented veggies, fermented fruits. There are some kinds of probiotics, prebiotics that you could take. One that Sean recently made a video, and I think it's very interesting because it has cultures that are related with brain health. It's called culturel. So maybe you should say it in your own accent. Culturel, Culturelle.
Cultural. Okay.
Yeah, and you could get that on Amazon. Yes. So I'm starting to use that, and that's mainly what I use. I tend to do more fermented by eating than by pills or anything else.
You take something, anything else for insulin resistant, oxidative stress, inflammation, endothelial dysfunction?
I like a good multi-complex vitamin because the majority of us are deficient in vitamin D3, vitamin B, vitamin E, vitamin A. So a good multi-complex vitamin. For sleep, sometimes, many times, I add magnesium bisglycinate 1 hour before I go to bed because it has L-theanine and it helps with my sleep. I do take hormone replacement therapy, which I believe it's important for all women that are getting into perimenopause and menopause to get a doctor that will work with you on that. Progesterone, estrogen, testosterone. What else do I get? I think that's what I get that I'm kind of remembering right now. Yes. And I do get my creatine every morning. Yeah.
Bioidentical hormones, I assume, not the horse hormones.
Yes. And the sauna and the cold showers and good quality of water. I'm trying to think here. What else do I do? Everything, all these things. Walking after your meals because it definitely helps. Walking during the sunshine, in the sunshine and sunset and sunrise. Standing up throughout the day because being sedentary has become worse than smoking. And the good thing about walking, and that's what I was going to talk about the movement, is that walking stresses your muscles. When you are moving your muscles, contracting your muscles, you are releasing myokines, which are molecules of hope. So it improves your mood. Walking also allows your brain to kick in and release BNDF, which is brain neurotrophic derived factor, which will improve brain regeneration and improve memory and cognition. Walking stresses your bones, microfractures that improve bone density, and walking builds collateral circulation everywhere in your body. So if you are used to walking and you have peripheral vascular disease, the more you walk, the more you have additional vessels that will help with the vascularization in case one of the arteries get very narrowed, either for your heart, either for your legs, everywhere else in your body, right? So that's really good.
Of course, one of your favorite is sprinting, if you're able to do sprinting.
Yeah, I'm not able to do sprinting, so I do sprinting in my bike, to be honest. I don't do sprinting. I don't like sprinting by running/sprinting. I like doing my sprinting in my bike. So yes. What else? Sprint. Oh, and do not forget your mindset. Do not forget your journaling. Do not forget your gratitude. Do not forget that everything you do has a belief. So then you do it, and then you are rewiring your brain when you start doing different strategies. But the most important is after you do, celebrate. Because if you don't celebrate, your brain is not getting addicted to you being your reward system.
And you talked about diet, and you gave a lot of general principles of, but would you say the Mediterranean diet or the Mind diet or just eating clean is basically what you talked about before? But would you put a label on it?
I don't want to put a label on anything. I'm thinking like I'm putting a label on the opposite. What we are eating is the sick diet, is the die young and die sick diet. You know, like we are eating all these processed foods, we are eating junk, we are eating ultra processed, we are drinking alcohol, we are not sleeping, we are smoking, we are vaping, we are using marijuana, whatever. Everything is the sick diet. That's not the normal way of eating, right? So I would go from there. I would think, okay, what I'm eating is the sick diet, not me anymore. But what the world is eating is the sick diet. And what I'm going to plan for me is evaluating everything that is a healthy way of eating, a healthy way of taking care of my body, and deciding what am I going to do in an easy and fun and simple way that I am going to keep doing no matter what. I'm not going to give up. Because if you restrict too much, chances are you might give up, right? I have many of the people who do coaching with me that say, am I never going to eat a piece of cake? Or am I never going to eat a drink of alcohol? Right now, you might be still craving the piece of cake. You might still be craving the drink of alcohol. I promise you that when you go further and further, you're going to regenerate your microbiome, that you're not going to be craving that anymore. But the more you restrict yourself, the chances are you're going to give up. So make it easy, make it fun, make it joyful. Decide that, okay, I cannot have processed foods, I cannot have alcohol, I cannot have sugar, I cannot have smokes, at least for the first 3 months. And then take care of your water, and then start stacking strategies with the walking and the sun and the sleep. And then if you want to have carbs, work on using the carbs that are low glycemic, work on eating before the sunset, work on walking after you eat. So slowly but surely, it's progress, not perfection, right? Slowly but surely.
With reverse osmosis water, which we talked about before, do you feel it's important to add minerals back into the water?
Yes. Good idea. Good question. Yes. So what I do, I get a bag of something called fasting electrolytes, and it's on Amazon as well. And I add the little scoop in the box, in the bag. It tells you how much you should put for each specific amount of water. I usually drink my big bottle of 1 water and then 2 more throughout the day. So you add the specific amount for the 1 liter of water, right? So I add the fasting so my water has 1 liter of water, the amount of fasting electrolytes that is indicated in the bag, and then I get mineral salt, and I add the same scoop from this one, from like a pinch, and I put my apple cider vinegar 1 to 2 tablespoons, and I dilute and I drink. Another electrolyte that you could use if you prefer flavor is, like, I'm not here to give any brand, but you could use Relight, you could use LMNT, you could use any electrolytes that would work for you financially and according to your taste as well. The mineral salt that I use is Redmond. I have heard that it's not the best quality of salt. However, I built a big box and a big bag, so I'm still using it because I haven't researched yet which one would be better. I know that some people get Celtic salt and they like it. I read and I haven't looked at it again, and I might be wrong, okay? So I read that it has more potassium instead of sodium, and I'm a little bit concerned of adding too much potassium to me, because potassium, if it's too much, it could be toxic, right? So I just don't want to be adding like potassium to my morning, potassium to my mid-morning, potassium to my mid, and then suddenly be having too much potassium. Again, I might be wrong, and forgive me for my stupidity if I'm saying something wrong, but I haven't researched yet what kind of salt I will use to replace the red mold.
Have you looked into Himalayan salt, the pink salt?
The pink Himalayan, yes. Again, some people say it's not a very good salt as well. So it's just so controversial. That's what I'm saying. Yeah. Get the basic knowledge and get all the knowledge and the basic knowledge. And then write down, which was what I did for me, and say, okay, I can do this. I cannot do this yet. And then start like adding. Get really good at one thing, like drinking water and fasting. Get really good. The first thing is cleaning your pantry. So get really good at not eating the junk food and the processed foods and the sugar and the alcohol. And then add the water, and then check the salt, and then get your filter, one step at a time, because otherwise it's overwhelm. Overwhelm equals stress. Stress equals cortisol. Cortisol equals inflammation. So you're not doing any benefit for you if you're getting overwhelmed, right?
So as we wrap up, is there anything that we left off? And if people want to get in contact with you or they want to learn more about you, how could they do that?
So I am on Instagram, TikTok, YouTube as Ana Rosa Gratitude, and you can find me there. I am a grief educator, and I work with grief, as I am a widow myself, and I walk the journey of healing from grief daily. So if you are if you're struggling with the loss of someone you love, or if you know someone who could benefit from holding hands and feeling safe and seen and heard, you could contact me on Instagram as well. And I do have a coaching group called Optimize You Life Program, where I work with nutrition, hydration, movement, and sleep. But mainly I work with how can I build sustainable success in all these strategies without sabotaging myself, and without beating myself up, by becoming my best partner, by neuroplasticity, becoming my best accountability partner and friend. So again, Optimize You Life Program is health for your body, mind, and spirit and soul. And Grief Support Circle is to hold the space in hope for someone who is struggling with the loss of a dearly one, the death of a dearly one. And you'll find me on Ana Rosa Gratitude. And I am so grateful for you.
Oh, thank you. And we did a great podcast on grief. People want to look into that. If you look up Ana Rosa or Open Your Eyes, Dr. Gelb on grief, we did a beautiful podcast on that for people that need help in that area. And then Dr. Rosa is kind enough to join me in the next hour, where we're going to change gears. We're going to talk about, can the right mindset change your life and even your health? In the next segment, Dr. Rosa will explore the power of the 4 agreements, Gary Zukav's teaching to unlock your dream of life. This is Dr. Kerry Gelb for Open Your Eyes. We'll see you next week. With more screen usage and indoor time, myopia, also known as nearsightedness, is increasing and getting worse in children. Now, certified eye doctors can prescribe MiSight One Day, the first and only FDA-approved soft contact lens to slow myopia progression in age-appropriate children. Visit CooperVision.com to find a Brilliant Futures certified eye doctor near you.